Good afternoon, friends. Now I will go to solve the top pathology questions. Good afternoon, friends. Now I am going to solve some top MCQ pathology questions. So I am interested in this live stream. If you are interested, please let us please join this live stream and enjoy the questions. I am going to bring it for you. Now I will be sharing my screen. I will be sharing my entire screen now. So here the first question is given as, what is the first question given here? The first question is given as neoplasia. Neoplasia means, what is the meaning of neoplasia? Can anyone say me in the chat box what is the meaning of neoplasia? Here the question is given as, what is the meaning of neoplasia? So neoplasia means new and uncontrolled growth of cells. So what is the meaning of neoplasia? Neoplasia means new and uncontrolled growth of cells. Okay. So the next question is, a benign tumor is characterized by, what is the cause of benign tumor in our body? So what is the cause of benign tumor in our body? Can you please help me with this question? What is the cause of benign tumor in our body? The cause of benign tumor in our body is option C, in which it is written localized growth without metastasis. Okay, so what is the cause of benign tumor in our body? The cause of benign tumor in our body is localized growth without metastasis. So now I will move to the next question. Here the next question is given as a malignant tumor is characterized by. So what is the cause of malignant tumor in our body? The cause of malignant tumor in our body is. So what is the cause of malignant tumor in our body? The cause of malignant tumor is metastasis. So what is the meaning of metastasis? So what is the meaning of metastasis? Metastasis means spreading of cancer cells. Spreading, spreading of cancer cells from original tumor from original. So what is metastasis? Metastasis means spreading of cancer cells from original tumor to other parts of our body. To other parts of our body. Okay. So what is the meaning of metastasis? Metastasis means spreading of cancer cells from original tumor to other parts of our body. And what is the cause of malignant tumor? Malignant tumor, the main cause of malignant tumor is metastasis. Okay, are you finding this question interesting? These are one of the most important questions of pathology and histopathology. Okay, so please like and subscribe my channel. It will be very much helpful and informative videos for you in the near future. I will bring more informative and helpful videos for you in the near future. So the next question is given as spread of cancer to distant site is called. So what is the spread of cancer to distant site known as? The spread of cancer to distant sites in our body is known as metastasis. Metastasis is a process in which the cancer cells spread from the main part of our body to other parts. Okay. Mm. So now I will move to the next question. So here the question is given as which suffix commonly indicates a benign tumor. So the question is given as which suffix commonly indicates a benign tumor. So the right answer of this question will be Oma. So do you know what is the meaning of suffix and prefix? Can anyone tell me what is the difference between suffix and prefix? Suffix means the last part of a word, and prefix means the front side of a word. Okay, so I will move to the next question. Here the question is given as here the question is given as cancer arising from epithelial tissue is called. So the cancer which arises from epithelial tissue are known as the cancers which arises from epithelial tissue is known as carcinoma. Okay, the right answer of this question will be carcinoma. So the cancer which arises from epithelial tissue is also known as carcinoma. Here the question is given as cancer arising from connective tissue is called. So what is the name of the cancer which arises from connective tissue? Can anyone help me to find out the answer of this question? The cancer which arises from connective tissue is known as sarcoma. The cancer which arises from connective tissue is known as sarcoma. So option B of this question will be correct. If you have any problem, then you can directly ask me in the chat box. I will definitely help to answer you. Here the question is given as the most common route of metastasis for carcinomas is. So what is the most common route for metastasis? Can anyone help me to answer this question? The most common route for of metastasis for carcinoma is lymphatic lymphatic spread. Okay, this is the right answer of this question. Lymphatic spread. So here the question is given as which. So I will move to the next question, and the question is given as which of the following is a carcinogen? Means which of the following causes cancer? Here we know that tobacco causes cancer. So tobacco smoke will also cause cancer. UV radiation also causes cancer, that is ultraviolet radiations. and asbestos also causes cancer. So the right answer of this question will be all of the above. Here the items which are present in the options, all of them causes cancer, and they are carcinogens. Carcinogens are objects which causes cancer in our body. So now I will move to the next question, and the next question is given as tumor suppressor gene commonly mutated in cancer. What is the name of tumor suppressor gene which is commonly mutated in cancer? Can you help me to answer this question? The name of the gene is P53. What will be the right answer of this question? The right answer of this question will be option A. Okay, so P53 is a tumor suppressor gene which is commonly mutated in cancer in order to prevent cancer or tumors in our body. So the right answer of this question will be P53. So now I will move to the next question. Here the next question is given as the guardian of the genome is. Who is the guardian of the genome? The guardian of the genome is P53 gene, which help us to suppress tumors in our body. Okay, now I will move to the next question, and the next question is given as which virus is strongly associated with cervical cancer? Can you help me with this question? If you like my stream, then please like and subscribe this channel so that I can bring more informative and helpful videos for you in the near future. If you just like and subscribe my channel, and if you hit the bell icon, then you can get my live streams very easily, and this will be very much helpful to you in your upcoming competitive examination. And please share my live streaming with your friends and families so that they can get benefited from this. So here the question is given as which virus is strongly associated with cervical cancer? The right answer of this question will be HPV virus. So if anyone asks you which virus is strongly associated with cervical cancer, you can just answer them HPV virus. And you have to learn it by heart. So now I will move to the next question. And the next question is shock is best defined as. Shock is best defined as inadequate tissue perfusion. So, what is shock best defined as? Shock is best defined as inadequate tissue perfusion. And what does it means? Inadequate tissue perfusion means our body and tissue do not get enough oxygen rich blood. Okay, so what does inadequate tissue perfusion means? Inadequate tissue perfusion means our body do not get oxygen, oxygen, oxygen rich, rach, rich blood. So if this condition happens in our body, that is when our body is not getting oxygen rich blood, then our body goes to shock. So shock is best defined as inadequate tissue perfusion, which means our body is not getting oxygen rich blood. Now I will move to the next question. And here the next question is, which type of shock results from severe blood loss? So when our body faces severe blood loss, then which type of shocks happen? When our body faces severe blood loss, then it causes hypovolemic shock. Okay, the right answer of this question will be option number C, and the answer is hypovolemic shock. What is the meaning of hypo? What is the meaning of hypo? Hypo means less. And what is the meaning of volemic? Volemic means volume. When we have less volume of blood in our body due to severe blood loss, then our body undergoes hypovolemic shock, and we have to remember it. So I will move to the next question, and the next question is given as septic shock is commonly caused by. So, what is the main cause of septic shock? The main cause of septic shock is severe infection in our body. So, what is the main cause of septic shock? Septic shock is commonly caused by severe infection in our body. So now I will move to the next question. The next question is given as an infraction is caused by. So do you know what is the meaning of infraction? What is the meaning of infraction? The meaning of infraction is it is the death of body tissue. Yeah, it is the death of body tissue. Okay. Why the death of body tissue is caused? Because it is due to lack of blood supply and oxygen. So, what is the main? What is infraction? Infraction means the death of body tissue, which is caused due to lack of blood supply and oxygen. So, what is the main cause of infection? So, the main cause of infection will be obstruction of blood supply, leading to tissue death. Death. Obstruction of blood supply, which is leading to tissue death. And what is infection? It is the death of body tissue due to lack of blood supply and oxygen. Is it clear? So now I will move to the next question. So here the next question is given as, so here the next question is given as the most common cause of myocardial infarction is. So what is the main cause of myocardial infarction? So do you know what is myocardial infarction? If you know, then just answer me in the chat box. What is myocardial infarction? Hmm. What is myocardial infarction? Myocardial infarction is a type of infection which is caused a myocardial infection is a type of infection which is caused when blood flow to our heart stops or drop too low. It is caused when blood blood flow in our heart muscles, muscles stops or drop too low. Okay. So, what is the most common cause of myocardial infection? Myocardial infection is caused when blood flow in our heart muscles drop too low. Means it drops very low. So, what is the main cause of myocardial infection? The right answer of this question will be coronary artery thrombosis. Means when the blood flow in our heart muscle stops or drop too low. Okay, now I will move to the next question. So now what is the next question? The next question is given as hypernia. Hypermia is what is hypermia? Hypermia is active increase in blood flow. Hyper means increase and hypo means decrease. So hypermia means the active increase in blood flow in our body. Okay. So now next question. I will move to the next question. And the next question is given as congestion is usually due to. What is the main cause of congestion? The main cause of congestion is impaired venous drainage. Okay. So what is the main cause of congestion? The main cause of congestion is impaired venous drainage. Now I will move to the next question. Here the next question is, so I will move to question number 131. And these questions are related to immunoglobulins. They are also most important pathology questions. I hope you will find very much helpful and informative video information from this set of questions. So please like and share my screen streaming, because sharing is caring and we need to educate everyone. Okay, so please like and subscribe this channel. It will be very much helpful to you. Please give me a thumbs up in the chat box and like my stream. Please like and subscribe my channel. So here the first question is given as. So here the question is given as which immunoglobulin is most abundant in serum? Can you help me to answer this question? Which immunoglobulin is most abundant in serum? It will the answer of this question will be IgG hemoglobin. Okay. Now I will move to the next question. The next question is given as which immunoglobulin is the first antibody produced during primary infection? So here the question is given as which immunoglobulin is the first antibody, means which immunoglobulin produces the first antibody during any primary infection. So the answer of this question will be IgM. IgM is the immunoglobulin which produces the first antibody during any primary infection. Okay, it produces the first antibody during any primary infection. So, which hemoglobin is the first antibody produced during primary infection? It will be IgM. Now, I will move to the next question. Where we can find IgA hemoglobin? So, where we can find IgA hemoglobin? IgA hemoglobin is mainly found in saliva, tears, and breast milk. Is mainly found in saliva, tears, and breast milk. Okay. Now I will move to the next question, and the next question is given as IgE hemoglobin is mainly associated with. So IgE hemoglobin is mainly associated with allergy. Is mainly associated with allergy and parasitic infection. So when any allergy or parasitic infection happens in our body, IgE immunoglobulin produces respective antibody for it to kill it. Now I will move to the next question. Which cells produces antibodies? Which cells produces antibodies? The cells which produces antibodies are known as plasma cells. So which cells produces antibodies? The cells which produces antibodies are known as plasma cells. Now I will move to the next question, and the next question is given as which autoimmune disease results from. So what is the main cause of autoimmune disease? So what is the main cause of autoimmune disease? Autoimmune disease is caused by immune attack against self tissues. So, what is the main cause of autoimmune disease? Autoimmune diseases are caused due to cell attack, means the cell immune attack on cell tissues. Now, I will move to the next question. Here, the question is given as HIV primarily attacks. HIV primarily attacks T lymphocytes. Okay, so what does HIV attack in our body? HIV attacks T lymphocytes. Hmm. So now I will move to the next question. The next question is given as which type of hypersensitivity is immediate? Which type of hypersensitivity is immediate? The type of hypersensitivity which is immediate is type 1 hypersensitivity. Which type of hypersensitivity is immediate? The type of hypersensitivity which is immediate is type 1 hypersensitivity. So here the next question is which test is commonly used to estimate hemoglobin? The test which is commonly used to estimate hemoglobin is known as Sahil's method. Sahil's method is a type of test which is commonly used to estimate hemoglobin. So, which test is commonly used to estimate hemoglobin? It is Sahil's method. Sahil's method is a method which is used to estimate hemoglobin. Now, here the question is given as a peripheral blood smear is mainly used to evaluate. The peripheral blood smear is mainly used to evaluate red blood cells, that is RBCs, erythrocytes, white blood cells, which are known as leukocytes, and platelets, morphology, which is known as thrombocytes. So, a peripheral blood smear is mainly used to evaluate these three things. One is their morphologies, means their shape, size, and everything to see under a microscope. That is RBCs, that is red blood cells, which are also known as erythrocytes, WBCs, that is white blood cells, which are also known as leukocytes, and platelets, that is thrombocytes. Why platelets are known as thrombocytes? Because it helps in clotting of blood. The normal ESR, that is erythrocyte sedimentation rate, is generally higher in adult females than males. ESR is generally higher in females than males. The females will be adult. Which condition commonly causes Rowleck's formation of RBC? Mhm. Which condition commonly causes Rowleck's formation of RBCs? Can you please help me to answer this question? The answer of this question will be multiple myeloma. What will be the right option of right answer of this question? The right answer of this question will be multiple myeloma. Multiple myeloma causes Rowleck's formation in red blood cells, that is erythrocytes. So now I will move to the next question. The next question is given as Hench bodies are commonly seen in Hench bodies. What do you mean by hinge bodies? Hinge bodies. Hinge bodies are known as. So, what do you mean by hinge body? Hinge bodies are known as teeny clamps. Teeny clamps of damaged hemoglobin of damaged hemoglobin proteins inside the RBCs. Okay, so what are hinge bodies? Hinge bodies are teeny clump of damaged hemoglobin proteins inside the red blood cells, and hinge bodies are commonly seen in. I think the answer of this question will be G G6PD deficiency. The answer of this question will be G6PD deficiency. Okay, so now I will move to the next question. So the next question is multiple myeloma is a malignancy of. So what is the cause of multiple myeloma? It is the malignant means it is the proliferation of plasma cells. So it is the proliferation of plasma cells. Okay. Now I will move to the next question. And here the next question is given as which laboratory investigation is essential for diagnosis leukemia? And the right answer of this question will be bone marrow examination. The right answer of this question will be bone marrow examination. Now I will move to the next question. And the next question is given as which blood component carries oxygen throughout the body? The blood component which carries oxygen throughout the body is known as red blood cells, that is erythrocytes. So red blood cells are component of blood. So red blood cells are component of blood which helps us to carry oxygen throughout the body. Okay, so I think you are finding these questions very much interesting. If you are finding these questions very much interesting, then please like and subscribe this channel so that you can receive more such live streams in your near future, and it will be very much helpful and informative to you for your upcoming competitive and medical lab technology examinations. So here the question is given as the normal pH of blood is approximately. So we know that what is the nature of blood. The blood is slightly alkaline in nature. Okay, blood is slightly alkaline in nature. So slightly alkaline. So the normal pH of blood will be 7.35 to 7.45. Okay, because blood is slightly slightly alkaline in nature. So blood is slightly alkaline in nature. So the normal pH of blood will be 7.35 to 7.45. Now I will move to the next question. Here the next question is given as the average volume of blood in an adult is approximately. So what is the average volume of blood in an adult? So what will be the average volume of blood in an adult? The average volume of blood in an adult will be 5 to 6 liter. Means 5 to 6 liter of blood is present in an adult body, in our body. Which anticoagulant is present naturally in our body? The anticoagulant which is present naturally in our body is heparin. And why it is known as natural anticoagulant? Because it is produced in our liver. It is produced. It is produced in our liver. Okay, so it is known as natural anticoagulant. So, which anticoagulant is commonly used for ESR by the Westergen method? Which anticoagulant is commonly used for erythrocyte sedimentation rate by which is done by Westergen method? I think the answer of this question will be sodium citrate. Okay, the answer of this question will be sodium citrate. Sodium citrate is the type of antigen which is commonly used for erythrocyte sedimentation rate, which is done by Westergen method. The normal erythrocyte sedimentation rate is generally increased in. The normal erythrocyte sedimentation rate is generally increased in pregnancy. During pregnancy, the ESR rate will be high. During tuberculosis, it will be high. During arthritis, also it will be high. So the right answer of this question will be all of the above. Okay. Now I will move to the next question, and the next question is given as which instrument is commonly used for manual cell counting. The instrument which is used for manual cell counting is hemocytometer or number chamber. The instrument which is commonly used for manual cell counting is number chamber or hemocytometer. Here the question is given as hemoglobin estimation by Sahil's method is based on the formation of. So here the right answer of this question will be acid hematine. So hemoglobin estimation by Sahil's method is based on the formation of this one acid hematine. Okay. So now I will move to the next question. Here the question is given as which strain is routinely used for differential leukocyte count? Which strain is commonly used for differential leukocyte count? The answer of this question will be Leishman strain. So Leishman strain is a type of strain which is used for leukocyte differential count, that is DLC. So which strain is routinely used for differential leukocyte count? It will be Leishman strain. Here the question is given as the normal differential count of neutrophils is approximately. So what is the normal differential count of neutrophils? The answer of this question will be 40 to 75% or 70%. The answer of this question will be 40 to 75%. 40 to 75% is the normal differential count of neutrophils in our body. Okay. Now I will move to the next question. And the next question is given as the normal percentage of lymphocyte in adults is approximately. What is the normal percentage of lymphocytes in adult? The normal percentage for lymphocyte in adults is 20 to 40%. I think you are finding this question very much interesting. These are the most important questions which might come or will come in your competitive examination. So here the question is given as monocytosis is commonly seen in. So what is the meaning of the term monocytosis? Monocytosis means production of the monocytes, production of monocytes. And what is a monocyte? Monocyte is a type of white blood cell in our body. So, when does monocytosis occurs? Means when production of monocytosis takes place. So, monocytosis is commonly seen in tuberculosis also, in viral hepatitis, and in chronic infection. So, the right answer of this question will be all of the above. So when we can see monocytosis, monocytosis can be seen during tuberculosis, viral hepatitis, and chronic infections. Now I will move to the next question. Here, the question is given as eosinophilia is commonly associated with. So, when the production of eosinophilia takes place in our body, eosinophilia is commonly associated with allergic disorders, parasitic infection, and asthma. So, the right answer of this question will be all of the above. So, when does eosinophilia takes place in our body? It takes place during allergic reaction, parasitic infection, and asthma. Okay. Now I will move to the next question. The next question is given as basophilia is most commonly associated with. Basophilia is most commonly associated with chronic myeloid leukemia, that is CML. So when does basophilia takes place? It takes place during chronic myeloid leukemia. So the right answer of this question will be option A. So now I will. This is the last question of this session. I will bring more such live sessions for you in the near future. So please like and subscribe this channel in order to find more such live streams in the near future, and it will be very much helpful to you in your every competitive examinations and in your medical lab technology school or college examinations. Okay, so please like and subscribe this channel and press the bell icon so that you get more such videos in the near future. And this will be the last question of this session, and the question is, which blood component is transfused in severe thrombocytopenia? Can you please help me to answer this question? Which blood component is transfused in severe thrombocytopenia? What is thrombocytes? Thrombocytes means platelets. So here the blood components which is transfused during severe thrombocytopenia is, the answer will be option C, that is platelets concentrate. The right answer of this question will be platelet concentrate. As you know that thrombocyte means platelets. So during severe thrombocytopenia, we have to transfuse platelet concentrate in the body of the patient. So thank you so much for giving me a patient hearing, and please like and subscribe this channel in order to get more such videos in your near future. Thank you friends. Thank you. Okay, thank you. I am signing off now from this session. Thank you friends.